The death toll in the UK continues to surge, with figures just released confirming that 828 people have died in England alone in the past 24 hours from coronavirus. Nearly 56,000 people have been infected across the country, among them Prime Minister Boris Johnson, who remains in intensive care. Boris Johnson was given supplementary oxygen. Cabinet ministers say he's in a stable condition and is in good spirits. Rory Challens joins us now live from London, outside the hospital, actually, where Boris Johnson is being treated. First, let's talk about these numbers, Rory. 828, that's the death toll just in England. So likely it's going to be a very bad day for the UK as a whole.
Yeah, if you add up the numbers that have been individually released by the English Health Authority, by the Welsh Health Authority, Scottish, Northern Ireland, etc., then the total that you get for the UK as a whole at the moment is 936 deaths. Now, let's just put a massive caveat in there, which is that these figures are likely to be undercounted, but they're also likely to be slightly over what the UK's Department of Health puts out later in the day as the aggregate number for the whole of the country. Just because of the way that all these numbers are counted up, there's always a bit of variation, and it always looks a little bit confusing. They are likely to be undercounted because we know that these are only the deaths that are taking place in hospitals, and even so, there are other hospital deaths that are going to be pushed into the numbers eventually over time. There are going to be many more deaths happening outside of hospitals, in care homes, etc. But what we know, I think, from this is that the trajectory of the UK's epidemic is still on the upwards incline. It's going up and up and up day by day with a few variations. But yes, this is still a situation that is getting worse and worse and worse in the UK on the death side of things. On the hospital admissions and the new cases side of things, well, then there's a bit more optimism there, because the chief scientists and the chief medical officers are saying that they are, I think, starting to see some levelling off. They've been saying that for a few days now, a levelling off in the number of new hospital admissions and new cases.
And Rory, do we know any more about how Boris Johnson is doing, other than he's in good spirits?
Well, we're basically beginning the same updates for a day and a half now. Every time a spokesperson for the Prime Minister comes out, or a government minister, and talks about his health, the message is pretty much identical. He's stable, clinically stable was the most recent way of putting it, that he's been given oxygen, or is being given oxygen. He hasn't been put on a ventilator, he hasn't got pneumonia, and he's in good spirits. That's the script. And what we've been told that is, I think, new in the last couple of hours is that he seems to be responding to treatment. Now, we don't know what treatment he's getting other than oxygen. So it suggests that he's not getting any worse, but we're also not being given any indication that he's leaving intensive care anytime soon. We have been told that he is not working. And so, you know, we knew that. That means that Dominic Raab is acting as Prime Minister. But here we're getting, I think, the first signs of cracks in this situation, with the decision announced by Dominic Raab recently to defer the review of the UK's lockdown, which was supposed to be taking place at the beginning of next week, by April the 16th latest. But in the last few hours, the Prime Minister's spokesperson said, hold on a second, no, this review is going to be taking place as scheduled. So yes, what mixed messages coming from the government at the moment, as you might expect, with Boris Johnson being sick in his hospital bed behind me, and someone else deputising for him at the moment.
Here's hoping we get some clarity. I believe there is a briefing due in the next few hours. For now, thank you. Rory Challens, live from London.